Chronic pancreatitis is certainly a very complex disease that requires thought about all of the different treatment options. What are some of the medical treatment approaches for patients with chronic pancreatitis?
It's really, as you said, because it's a complex disease, so it does lead to different layers of complications on the patient's health. So the best way to treat it is really to take that broken into different aspects. So the chronic pain component that comes with it, that has to be adequately treated, and it's best treated when the patient is seen by specialized teams that have a great pain doctors, a psychologist involved, because usually the psychology and the psychosocial aspects of patient's life and the family's life is affected by this disease. So a holistic approach, in other terms, for this would be very much needed. From a gastrointestinal, if I may say, chronic pancreatitis leads to a lot of problems. It could be malabsorption with the loss of function, so that has to be investigated and treated. Optimizing nutrition, whether enzymes are needed, and making sure that from chronic pancreatitis that they're not having other conditions where there is disharmony in the bacteria in their bowels. So sometimes it could lead to what we call bacterial overgrowth and how that should be treated. Diarrhea, bloating, so treating those symptoms. And then you have the endocrine aspects of things. So then if the islet cells that make insulin to prevent diabetes get hit by this disease or get affected, then that has to be treated as well and studied, and it varies from patient to patient.
So all of these needs are really best served thinking about a multidisciplinary approach. I mean, so all of the components are all critical, they all play a major role. Pain service, endocrine, GI, those are all really critical to bring everyone to the table at the same time.
Very important, because sometimes one aspect could affect the other aspect, and if you don't treat that in a multidisciplinary fashion in the same patient, then you might not get the best outcomes for the patient.
Mm-hmm. What about patients that happen to have some anatomy problems that we find on MRCP, on that magnetic resonance imaging that we utilize often to diagnose chronic pancreatitis? So say you have a dilated duct or you see stones in the duct in a patient with chronic pancreatitis. What's the approach there?
So that's where you need like an endoscopic role for the therapy, and usually by advanced endoscopy or what we call the ERCP, and sometimes it's a combination of an ERCP with an endoscopic ultrasound, EUS, where you need to treat. And hopefully, if there's a narrowing or a stone, when you treat it, hopefully to alleviate some of the pain that could be with it, or maybe prevent other attacks. So that's where the endoscopy has a role in the intervention.
And it's also quite clear that even if you find anatomy problems, duct problems, stones that you're relieving with ERCP, not all of those patients get better, right?
I agree, and that's what we see from where the chronic pancreatitis could lead to problems in either the frequency of the attack or the chronic pain, that patients would absolutely have undergone all the medical aspects that we covered, as well as endoscopic aspects, and even had multiple repeated ERCPs and dilations with stenting to kind of prevent what we call obstruction to the flow of the pancreatic juices, but they would have failed all of that, and that's when we really would consider surgical approaches or offering surgeries in chronic pancreatitis.